Good day, my name is Nguyen. You can call me Danica as well, and this is my student ID. Today I will present about breast cancer. For today's agenda includes pathophysiologies and risk factors of breast cancer, pain management and wound care post-operations, and patient education before discharge. Come to the first one, pathophysiologies and risk factors of breast cancer. Breast cancer is the heterogeneous disease that develops through a sequence of genetic, molecular, phenotypic, and pathologic changes. It begins as carcinoma in situ, such as ductal carcinoma in situ or lobular carcinoma in situ, where abnormal epithelial cells proliferate. The disease progresses by genetic mutations involving key oncogenes and tumor suppressors, such as breast cancer gene 1, BRCA1, breast cancer gene 2, BRCA2, and human epidermal growth factor receptor 2, HER2, which trigger uncontrollable cell growth and genomic instability. Tumor cells may metastasize through epithelial to mesenchymal incisions (EMT), enhancing the invasiveness to nearby tissues, resulting in the progress of breast cancer. In these case studies, Amara, the patients, diagnosed with a stage 3C invasive ductal carcinoma, was found to have mutations in the BRCA1 gene following a genetics testing and counseling. When BRCA1 is mutated, damaged DNA cannot be repaired effectively, causing an accumulation of genetic mutations and consequently development of the breast cancer. And there are several risk factors influencing the oncogenesis of the breast cancer, such as gender, age, personal medical and family histories, lifestyle, diet, hormonal factors, and genetic mutations. In our situations, she's a 45-year-old woman with 4 children, aged between 2 to 14 years old, and she has been confirmed with BRCA1 mutations. And accordingly to Australian Institute of Health and Welfare, female sex and increase in age are the two of the strongest established risk factors, with nearly 100% of the majority of cases occurring in women and incidence rising significantly after the age of 40, as you can see of the chart. On top of that, BRCA1 and BRCA2 can enhance the risk of developing breast cancer. On the other hand, the more times a woman has given birth, the lower her risk of carcinogenesis. In Amara's case, however, having the first child after 30 years old elevates susceptibility to breast cancer. Therefore, even though she has 4 children, she gave birth to her first child when she was 31 years old, which may contribute to the reason why she has an increased risk of developing breast cancer. Come to the pain management. Before administering medications and providing therapies, critical pain assessment and patient evaluation should be conducted to assess appropriate pain management strategies. For example, analgesic ladder. This approach recommended by the World Health Organization suggests the use of the non-opioid medications, such as non-steroidal anti-inflammatory drugs and acetaminophen, such as paracetamol, for mild pain. For moderate pain or severe persistent pain, tramadol and codeine, as well as morphine, oxycodone, and tapentadone can be charged respectively. In addition, it can be prescribed with or without non-opioid analgesics and or adjuvants to optimize the effectiveness to reduce the adverse effects. We can use the non-pharmacology therapies such as relaxation therapies, physical therapies, or acupuncture, which can reduce pain, swelling, and damage to the tissue. Acupuncture works by stimulating specific nerve points, known as acupoints, to promote pain relief and relaxations. However, due to the Amara's current conditions with 2 wound trains in situ, pharmacological intervention should be prioritized, whilst acupuncture should be considered as a complementary therapy only. And for wound care, postoperative wound healing occurs in 4 stages, and it needs nurses to monitor the surgical site and wound dressing so that they remain dry, clean, and intact to reduce the risk of complications. Dressing changes should be performed according to the extrusional protocols using aseptic technique to minimize infections and contaminations. Occasionally, nurses might cleanse the surrounding skin gently with normal salines and gauze to remove dry blood or drainage before applying to a new dressing. Furthermore, the trainer should be emptied several times per day and documented using the train measurement log, which is this one. This log monitors the color, volume, and consistency of the drainage output. The outcomes are expected to gradually diminish and appear red, pink, or watery looking. The documentations assist the healthcare team in determining the appropriate time for drain removal. In Amara's case, if the drainage output decreased steadily, indicating positive recovery, drain removal can proceed as planned within 1 or 2 weeks. Nurses should ensure the drain tubing remains patent by milking the tube when necessary to prevent blockage. Effective management and monitoring the surgical training should be provided to identify early signs of infections or actively bleeding to enable prompt nursing interventions. Signs of infections include a high temperature, which is like 38 degrees, or swelling or worsening redness around the insertion site, and pus from drain. Come to the patient educations. Prior to discharge, nurses play a key role in providing education to patients to ensure that they are able to look after themselves safely. The education includes avoiding several daily activities such as lifting heavy things, doing heavy exercises, or oversketching for a minimum of 3 days post-operations. And being aware of the dizziness while mobilizing, like moving around or suddenly stand up because of the anesthesias or side effects of the painkillers. Patients should also acknowledge the risk of lymphoedema, which is the root of the lymphoedema is cancer treatment due to the removal of the lymph nodes, causing the dysfunctions of the lymphatic system, which is used for the transporting tissues fluid that escape from the blood capillaries. And since Amara has modified radical mastectomy, which may remove from 10 to 40 lymph nodes from the armpit, she has a high chance of getting lymphoedema. Therefore, Amara and all the patients should be educated to seek their GP or attend the nearest healthcare facility once they recognize early signs of lymphoedema, such as limb heaviness, swelling, or aching, to prevent further deteriorations of the conditions. Therefore, providing methodologies to prevent development of lymphoedema or support lymphoangiogenesis, such as the vascular endothelial growth factor C drug that aims to stimulate lymphatic vessels and repair, or microsurgical lymphovenous bypass, where surgeons connect lymphatic vessels to veins to bypass block the lymph flow, or BioBridge, with a surgical implant that supports lymphatic regenerations. So that is the end of my presentations about breast cancer. This is my reference list, and thank you for listening.